So we're going over the passive accessory movements for the hip. Some of these can be really great for reducing pain and increasing range of movement for OA. Just going through just a light bit of draping. So we just want to tuck up underneath the shorts. We'd obviously ask consent before we get to this point. The first one that basically we're going to go through is a longitudinal movement in slight flexion. So we're in about 30 to 40 degrees hip flexion. You will find that it helps to support the patient's knee, because otherwise they will be trying to contract to prevent the knee from dropping out. So we just try to support that. What you'll find is a kind of an overhand grip is usually best for this one. We grab around about a third of the way on the proximal side, and then we basically take up some tissue slack so that we end up about mid-femur, and then basically we use our body weight through our legs, kind of a reverse lunge, to try to create that distraction force. So we take up the tissue slack, we do a slight oscillation there, which would be grade 1. We take that to 0 to 50%, which would be grade 2. And then we go from 50% to end of range, grade 3. And then grade 4 will be taking to end of range, and then just a small oscillation there at end of range. So from there, if we move into full flexion, we do more of a cordad movement, which is drawing straight down towards the feet. We can support the knee just on our chest, and basically from there we kind of have to get a little bit closer up in towards the femoral groove there, and basically we go there, take up tissue slack, and then we stabilize, taking to grade 1, and then a little bit further, grade 2, 0 to 50%. Remembering that we're almost using the knee as a fulcrum, and we're distracting the hip away from the acetabulum. And then, so we're moving down towards the foot, rather than pulling up and away from along the direction of the femur. We're more going down towards the patient's foot, parallel to the bed. So going again, grade 2, going from grade 2 to grade 3, and then take to end of range for grade 4, and a slight oscillation there. So if we then go for a slight longitudinal movement in flexion and abduction, again we go overhand about a third proximal, take up the tissue slack to about halfway down the femur, and then again we distract. Okay, so this time we're going in the length of the femur, we're not going towards the foot. Take there, grade 1, grade 2 to about 0 to 50%, and then grade 3, 50 to end of range. And then if we take to end of range, take up a bit more tissue slack again, end of range, and then a slight oscillation there. Important to remember our body positioning, trying to maintain our posture. Again, I probably slipped into a bit of poor technique there. Make sure you have a wide base of support and focusing on the line of pull going in the correct direction. And then we had cephalad. So basically if we go from about 45 degrees hip and knee flexion, basically we're then using this one to try to push the femur directly in towards the acetabulum, trying to cram up any different structures in there, used more so as an assessment rather than a treatment. and basically we should feel kind of like a bony end, feel kind of relatively stiff with a slight bit of movement.